doctor in the UK, also clinical director of an organization called North South GP Federation. We're a large organization of more than 130 doctors. We help more than 500,000 population locally. We run many services, and we are the first ones to start a coronavirus or the COVID clinic in UK. We've been running this probably from early March, and we have seen hundreds of patients. I would like to share a few information which we gathered here to the general public, which will be helpful in this critical time. I've been sent a few questions. We'll go through them one by one. The first on my list is, how does this virus transmit, and what are all the things we should be doing to avoid it? The most common way this virus spreads, like any other virus, is through droplets, through close contact and bodily fluids. There are other modes of transmission like fecal-oral route as well, but mainly it spreads through droplets. For example, cough and sneezing. Usually the droplets can transmit to up to 2 meters. That's why we're saying that keep away for 2 meters, the social distancing. What all we should be doing to avoid it? Well, you must have seen everywhere frequent hand wash, hand gels if possible, or hand wash for a good 20 seconds. Simple soap is good enough. You don't need to find a special agent for that. And obviously foodstuffs, you have to be careful. The route of transmission through food is not well proven, but it's possible. I'll come to regarding when it's safe to eat the food and things later on in the video. But the foremost things we have to do is follow the government guidelines wherever you are in, which is social distancing and isolation if needed. Stay at home if you don't have to go out, and that's the most key thing for this virus to die down and get it off from this world. This virus is a self-limiting virus, so it will go away provided we stay away from each other as much as possible and break the cycle of the virus spreading from one person to another. That is the key thing. And whatever other precautions you use, unless you do this, it's not going to go away from this world. The next question is, what is the current treatment of COVID-19 patients? Well, the treatment is mainly of threefold in UK. Probably will be the same in the rest of the world as well. Most patients don't need any treatment. It's literally mild in many people. More than 30% would not have any symptoms. About 60-70%, probably about 60% will have mild to moderate symptoms, and around 10% will have severe symptoms. Another 10% will have critical symptoms. So for no symptoms and mild symptom people, just stay at home. Paracetamol is the best. There are some things about whether you can take ibuprofen if there's temperature. There are a lot of studies going on. There's nothing proven, but what we're suggesting people is just take paracetamol as and when required. Plenty of fluids, rest. Apart from that, there is no other specific treatment has been proven as of today which will be beneficial. A lot of trials going on, especially around some anti-malarial drugs and antiviral drugs. There's a lot of talk about hydroxychloroquine and chloroquine, along with the drug called azithromycin. There's a lot of media attention on it. Well, the fact is, there's no proof that it's helping, and there's no proof that it's not helping. So in my opinion, you should not be taking without consulting your doctor, because both of these medication, if they take them together, can actually stop your heart, and especially for people who have heart conditions. So do not take them unless you consult your doctor. I'm talking about hydroxychloroquine and azithromycin. Other treatments include, in the community, probably not a lot, but when a point comes that their oxygen levels drop, they have to admit to the hospital. And there's the kind of treatments available are simple oxygen, and then there's other treatments which includes ventilators, and just slightly below ventilators, other forms of treatments as well. I don't want to go in detail about it, but there is no proven treatment outside the hospital which is going to be effective for COVID-19. The next question is an interesting one. Should one be concerned and get tested if they develop one single symptom of cough, fever? When would you recommend anyone to go get tested? Now, this is an important question people have to understand. Now, testing is not available worldwide, and it's not available freely anywhere. So it's impossible to test everyone. And to be honest, in my opinion, not everyone would need testing. If you have symptoms, stay at home. That's the main thing first. And if you become very unwell, then you seek help. Symptoms wise, the main symptoms people do get are fever. 85% of people do get fever. Cough and sore throat, around 60-70% people do get it. Other symptoms include muscle pains, diarrhea can happen. People can have breathing difficulty up to 20%, and those are the difficult ones. It typically starts with, comes to the next question. The next question is who has to get tested? The testing depends on where you live. In many countries, they actively test for people who have symptoms and then isolate them. In some countries who don't have enough testing, they do only in the hospital if they get worse. So it depends on where you live. In my opinion, not everyone needs testing at all. How long is it taking an average patient to completely recover? That's the next question. So it goes along with that. Now, typically the symptoms start on probably around 3 to 5 days after you contact the virus, but it can last up to 14 days before you actually start the symptoms since you got the virus. It starts typically with fever. Then it goes to cough and sore throat. Other things can happen like muscle pains over the time. Most of them, I'm talking about most of them, settles around 6 to 7 days. You should start feel better. However, if you start, if you kind of starting to feel a bit worse from 8th day onwards, which is when we expect all the complications to happen. So if you got better around 6 to 7 days and starting to get worse around 8 to 10 days, that's the time it means that the virus has gone to the lungs and you could develop pneumonia. So you got to be careful on that. It typically presents with breathing difficulties around the time, and you should seek medical attention at that point. Most people recover, as I said, around 7 days, but it can last for up to 28 days, especially the cough can last for a very long period of time, even after the virus is gone from your body. So cough is not the reason you should say that I still have the virus. Cough can persist for longer than the disease. That's an important point to note. Next is a very important question. Is it possible for younger adults with no other health conditions to die of this disease? Now let's talk about who gets affected and who gets really worse part of it. In theory, anyone can get it. In fact, what we're seeing is patients from the age of 6 months to the age of 99 are getting it. The virus doesn't spare anyone. However, younger people they do fare well. They recover quicker than older people. Saying that, we have patients at the age of 25 died, dead, and then there's people at the age of 15 who's in the hospital on ventilators, and we have a 30-year-old athlete who died in the UK who had no other medical conditions, fit and well. However, these are exceptions. Generally, the fatality rate under the age of 50 is 0.5, which is quite less. The worry is not you getting the problem. The worry is you getting the virus and passing on to an elderly person at your house. Could be a father or a grandfather, and that's the reason why young people should stay at home and prevent the spread of this disease. In theory, it can affect anyone and it can kill anyone, but the chance of complications is less in younger people. There's a group of people in which the complications are higher, even if you're young. These include people who have asthma, smokers, because smoking destroys important immunity in your lungs, which makes it prone for complications. They're saying even up to smoking of up to 3 years is a good risk factor, as severe as asthma sometimes. Serious heart conditions is a risk factor. People who are on steroids or on cancer treatments, they are at risk. People who have liver problems and kidney problems are at risk. Diabetic populations are at risk. People who are extremely obese with a BMI of more than 36 are at risk. These people, the age doesn't matter. Even if you're 40 and if you have one of them, you are at risk. So you got to be careful. When I say at risk, risk of developing complications and getting admitted to the hospital. So in UK, we kind of shield this patient in their house, and the government is supplying food, everything to their home, so that they were not exposed in the community. Next is an interesting question. Is it possible for this to reoccur at a patient who already recovered from this disease? Now, there is not enough evidence to say yes and no for this question. However, what we know, the immunity people get is only a temporary one, and it is not a lifelong immunity. There are some data coming out from that. Now, this virus is quite notorious to mutate, so we don't know how it's going to mutate down the line. Probably mutate means change its course, changes structure, and so we don't know how it's going to react a year from now on. So it's a difficult question to answer, but the answer, straightforward answer, if you ask me, potentially yes, can happen. However, it depends upon how the data is going to come out. Certainly, one thing we know, we're not going to get a lifelong immunity from this disease by just exposing ourselves once. Next question is, does this disease create permanent organ damage such as lung damage? Now, in my initial video, I said that some people develop lung problems around 8 to 10 days. Those people, if they suffer a lot and if they go into hospital for ventilator and for a very long period of time, those people can develop long-term lung problems, but majority of them come out with no other long-term consequences. Scar tissue can form in lungs if someone has been ventilated for a long period of time. That's not just for this disease, for any pneumonia, any disease which affects the lung. So the possibility is yes, but not for majority of them. Very, very small percentage. I'm talking about 2 to 3%, very minimal. The next question is, would you recommend any food lifestyle changes that could potentially help prevent or help battle this disease? Now let's talk about prevention. Now, healthy diet is important because healthy diet can tackle with any virus disease like this one. There's a lot of data coming out regarding vitamin D. People who are deficient in vitamin D are more prone for viral disease generally, because vitamin D is important for immunity. So make sure you have a good supply of vitamin D, either through sunlight or through nutrition. Generally, a balanced diet is important. This is not the time to starve or diet to lose weight. You can do it with a balanced diet, but don't do it aggressively, because if you do it aggressively, immunity goes down and you can get simple infections. Things like, there is something, a note about turmeric, garlic. There is no enough evidence to say these things is going to be helpful specifically for coronavirus. But these things do help generally to build up the immunity of a person. So I'm going to say that it will help, but don't put your money on that. It's not going to save you from getting this information fully, but it will definitely help. Plenty of water, keep yourself hydrated, that's really important. Apart from that, there's nothing, a single food item is known to prevent or help cure this disease. So all the fake news going around, please don't get fooled around by it. A lot of people make use of this opportunity to make money, to sell things. So please stay away from those things. Are smokers at risk of disease? As I explained before, they are definitely at risk. Some research have said even 3 years of smoking will completely destroy an important part of your lung called cilia, which is important for fighting diseases generally. And that's why smokers get infected so often and they're not spared from coronavirus. We have healthy adults who are just smokers in ventilators in our place. So smokers, be alert and be careful. Is it safe to order food from restaurants at this time? Is it possible to get infected through food packaging? Now, uncooked food infected, possible, and you all know that's how it came to the world. Packaging, possible. Let's talk about the virus itself, how long it can survive in places, which could explain this. Now, generally, there are a lot of research going on, but what we know at this point of time, at 4 degrees Celsius, this virus can survive for up to 28 days. At 23 to 25 degrees Celsius, it can survive only up to 72 hours. Can be a bit longer, but around that 3 days period. At 70 degrees Celsius, which is while heating food and things, it survives only for 5 minutes like any other virus. So it's not a super virus, it is susceptible to heat, but you got to heat for 5 minutes for 70 degrees for it to die generally. There is a myth going on whether hot weather is going to cure people or reduce this virus. The answer is it can have an effect. It reduces the spread of the virus because when the temperature goes above 25 degrees Celsius, the lateral spread, which is person to person spread, can slow down, won't stop, but slow down because it can still survive for up to 3 days in surfaces, even at 25 degrees Celsius. Now, a different kind of surfaces, it kind of varies. For example, plastic and steel, they can survive for longer than cardboards and fabrics. No, cardboards. Plastic and steel, they can survive a bit longer, up to 5 days sometimes, so to be careful there. The next question is there any evidence the virus won't survive in hot weather, which I've answered already. So it can survive, it can slow down the spread, but it can survive. So don't be fooled around that in summer it's going to go away. It's not. It can still spread between people to people. The next question is, what should I do if I have coronavirus symptoms? Well, the best thing is stay at home. There's a lot of information on the websites, but go for genuine websites. But stay at home, that's the advice. If your symptoms get a lot worse, seek medical help. But majority of the patients do suffer a little bit. So the threshold of people can differ, so it's difficult for me to say. But the point when you need medical help is when you develop shortness of breath. Temperature, cough, sore throat, please stay at home. Don't go out and spread to other people. But stay away from elderly people within your house. If possible, change of place so that elderly people can stay away from you and people who have susceptible other conditions can stay away from you. There's another question about children, whether children gets worse, but the answer to that is there's very little mortality among children. Newborn children under the age of 3 months can potentially have complications because their immunity is not as strong as others. But other children after the age of 15, the mortality is pretty less, the complications are pretty less. They recover fairly quickly than others. So that's one reassuring thing for the parents. They do get it. It's not that they won't get it. They do get it, but they get better quicker and less complications expected from them. But children are super spreaders, so careful of them going into elderly people at home and spread to them. But that's the risk. Please spread the correct information rather than spreading fake news, which doesn't help at this critical time. You have my email address and WhatsApp. If you have any more questions, do email us and I'll try to answer in my next video. Thank you.